Welcome to Long Covid Doctor, an educational series for sufferers of long Covid. I'm Dr. Tim Robinson, formerly a GP for 30 years, now GP lead for 3 NHS Long Covid clinics and clinical lead for long Covid across the southwest of England. This episode is on sleep disturbance and long Covid. I will be talking about the symptoms, the treatments and management of sleep disturbance in long Covid. References, links and resources are in the show notes below. Any treatments that I mention should only be considered after discussion with your own GP health provider. And so, here we go. Sleep disturbance and long Covid. Sleep disturbance and long Covid, certainly in my experience in my working in my long Covid clinics, is an extremely common problem in patients who are suffering from long Covid. It's important to understand for a number of reasons, to find out the causes for it, to understand why it occurs in long Covid, to find out any ways to help to resolve it. And sleep, really, as we all know, is an important part of the recovery from long Covid. So first of all, what is normal sleep? What is deemed as normal sleep? Sleep is the state of reduced mental and physical activity in which there's sort of consciousness is altered, but you're not unconscious. Motor activity, the sort of movement of limbs, etc., is altered. Voluntary activity is turned off, but involuntary activity, so the heart rate, the breathing, etc., is left on. Sensory activity is sort of turned down, it's inhibited. So while we sleep, we go through various sleep cycles, alternating between two types of sleep. The very deep sort of slow wave sleep, it's called slow wave sleep, SWS, slow wave sleep, non-REM, I'll come on to that REM in a minute. And then there's fast wave sleep, shallow dreaming sleep, the REM sleep. Now, REM stands for rapid eye movement. It's called rapid eye movement as your eyes flicker whilst you're asleep during this dream phase, okay? So basically, most people sleep between 7 and 8 hours a night. That's the normal sort of pattern. And it's divided into phases. You've got the deep phases and the shallow phases. The deep phases, mostly sort of 5 or 6 of those through the night, bursts of REM in between those phases, the dream rapid eye movement phases. So what is the function of sleep? Basically, it's to restore and repair. Basically, as we all know, the old saying goes, sleep is a great tonic, sleep is the great healer. All the systems in the body, the immune system, the endocrine system, the nervous system, muscular, skeletal, all the organs in the body, all the cells throughout the body are repaired and restored during sleep. Breakdown products of metabolism are removed, if you like, a spring clean every night. The repair of damage and replacement of worn out cells, worn out parts occurs during night time, during sleep. Just as importantly, sleep is necessary for all things that is happening sort of in the brain, the maintenance of your thinking functions, your cognitive function, your memory, your mood. Sleep, as we all know, occurs at night when it's dark, which brings me on to the day-night cycle, the so-called circadian rhythm. This is important for all those rest and restore functions. It is also governs the release of the hormones, of certain hormones with the day-night cycle. There's growth hormone, the tissue repair hormone, that is mostly secreted at night. There's melatonin, the natural sleeping hormone, sleep hormone, sedating hormone that we all produce is released at night. Cortisol is produced at the end of the night and the early morning. That helps us get up and go and sort of gear up for the day and face the day. So a day-night cycle, release of hormones, is really important for all these reasons. So what happens if we don't get a regular good night's sleep, if you have sleep disturbance, as we are finding in long COVID patients? So obviously, all those rest, restorative, repair processes are not working optimally. Therefore, they're not working most efficiently and therefore at their best capacity. This is not ideal while we're trying to recover from long COVID. Adverse effects are seen in the immune system, that's impaired, and studies show that. Cognitive function, your sort of thought processes, concentration, alertness, memory are all impaired if you're sleep deprived or impaired. Mental well-being, again, that's affected if you have sleep disturbance. As an effect on the mood and irritability, that leads to, clinical conditions such as anxiety and depression. So what are our patients, our long COVID patients, telling us with regard to their sleep disturbance? How is sleep disturbance presenting with them, and in what way is it disturbing them? They're telling us that all sorts of things. They're telling us that they have insomnia, they have difficulty getting off to sleep, taking time to get to sleep. This is so-called sleep latency. There's interrupted sleep. This is sort of waking repeatedly through the night, maybe hourly. Patients are also telling us that they're waking in the early hours for no reason, or other things like, excessive dreaming, vivid or even distressing dreaming. They're also telling us that they're waking, feeling completely unrefreshed, even after a 7-8 hours sleep, or even longer. Some of our patients are sleeping for 12-14 hours and still waking up feeling pretty dopey. So why are our long COVID patients getting sleep disturbance? What's the explanation behind this? Particularly, patients are asking this who previously, prior to COVID, have had normal restful sleep every hour, every night, 7-8 hours. But now, since having COVID, they've got sleep disturbance. Why is this? Well, first and foremost, as I've said before in previous podcasts, that basically long COVID is complex and complicated, with multiple causes, dysregulations and dysfunctions. So all symptoms in long COVID result from many possible causes and explanations, not just one cause, one explanation, unfortunately. So therefore this applies to long COVID sleep disturbance also. So what are the possible causes for sleep disturbance in long COVID? So on the simplest level, patients who are unwell are not getting tired physically or mentally because they're unwell, they've been less active than usual. Hence, they've burnt up less energy, got less tired, and less in need of sleep as a consequence. Maybe our long COVID patients have given into a long daytime nap, understandably, and so therefore if they've had a long nap in the daytime, they won't be so tired at bedtime. Therefore they can't get to sleep, then they get into a sort of, if you like, chaotic sleep routine, and even a sort of reversed sleep pattern, awake all night and asleep all day. Or maybe it's due to other long COVID symptoms that the patient might be experiencing at the same time as their sleep disturbance. So they may have sleep dysregulation. Again, this is a common symptom in our long COVID patients. They've got sort of dysregulation of their temperature control. They either feel hot and sweaty and flushing at night, or chilly, cold, or alternating. Patients may have tinnitus, and tinnitus is the ringing in the ears is always more noticeable at night when everything else is quiet around you. And a lot of our long COVID patients have muscle aches, joint aches and pains, just can't get comfortable. Again, long COVID problems. Or maybe another explanation for sleep disturbance is the gut dysbiosis. What do we mean by that? The friendly flora, the friendly bacteria, bugs in your gut, in your intestine are disturbed. We see this, and this is well documented and studied in long COVID patients. As a consequence of this, the gut flora is not ideal. It's what we call dysbiosis, and so therefore the normal functions of the gut flora are not as good as they could be. So one of the functions is secretion of neurotransmitters, such as serotonin, the happy hormone. 90% of that is produced in the intestinal cells. GABA, the calm hormone, is also produced in the large bowel. Both are reduced, and this may contribute to a tendency for anxiety and depression, which in themselves have sleep disturbance associated with them. So gut dysbiosis in long COVID can be a contributing factor to sleep disturbance. And finally, and I think most interestingly, the long COVID effects on the brain overall, the central nervous system. We know that long COVID disrupts the balance of the sympathetic and the parasympathetic nervous systems. The patients are stuck in the fight or flight mode, adrenaline charged. We know that the HPA axis, the hypothalamo-pituitary adrenal axis, is disturbed, and so the cortisol release from the adrenal glands is disrupted. We know that the levels of cortisol are reduced. We see this, interestingly enough, in ME/CFS as well. The neural pathways between the hypothalamus and the pineal gland are probably disturbed as well. Remember, that's the pineal gland is where the melatonin comes from. Our body's own natural sleeping pill is produced and secreted from. Long COVID can mess up that process and that nerve pathway, and so you don't have your own natural melatonin being produced. There's the disruption of the limbic system, part of the autonomic nervous system for emotional processing and memory foundation, and hence as a consequence of this, there's anxiety and memory dysfunction, and that contributes to brain fog. All these things. And then finally, we know that long COVID interrupts the various nuclei, that's collection of nerve cells in the brainstem, the dorsal brainstem that look after and deal with nausea and pain and sickness behavior response and sleep function, are all going to be disturbed in long COVID. So there are multiple reasons for these processes to be occurring. And again, I've talked in previous podcasts about the sort of what we call pathophysiology, the causes behind long COVID in general, but these can all apply throughout the body, and particularly in the brain. The excessive inflammation, the sort of blood microthrombi, the inflammation of the blood vessels, the myelin loss of the nerve cells, how the nerve cells are affected. All this, I could go on forever and ever. All this contributes to sleep disturbance. And finally, I don't think we should it shouldn't go unnoted that one of the other consequences of long COVID is the effect on the person overall, not just sort of the person who's not getting better, the effects on the patient who has had their COVID for a long time, and the effects that, therefore, the knock-on effects on their family, their relationships, their friendships. They can't work, the financial effects, a life robbed, hopes and dreams smashed. All totally understandable worries and stresses and fears may lead to sort of anxiety and depression, which, of course, like I've said before, all contribute to sleep disturbance. So that's a very long answer to the question, what are the possible causes for sleep disturbance in long COVID? I mean, the short answer is there are tons of reasons for sleep disturbance in long COVID. This leads on, therefore, if we've got this problem, how are we going to help with sleep disturbance in our long COVID patients? So, firstly, we need to rule out other causes for non-long COVID causes for sleep disturbance. So, just to make sure, simple things really, make sure the patient isn't taking too much caffeine, coffee, tea, energy drinks. Alcohol can disturb your sleep. Some medication can disturb your sleep, steroids, for example. Make sure that the patient's not got sleep disturbance because of joint pains, because of arthritis, or night sweats because of menopausal night sweats, or reflux, heartburn, and sort of nighttime cough due to acid coming up from the stomach, or sleep apnea. Make sure that people aren't having those periods of sleep, periods of absences in their breathing whilst they're asleep. Restless leg syndrome, heart failure. These are all sort of, like I've said, non-long COVID causes for sleep disturbance, and they all need to be thought about and excluded and addressed in order to help with sleep disturbance, and then see what we're left with to see whether the sleep disturbance persists and therefore can be attributed to the long COVID. Having ruled out all those causes, what advice would we be giving for long COVID sleep disturbance? Well, first and foremost, let's think about the non-pharmacological approaches. We've got to think about sleep hygiene, and I'm sure that everyone's sort of thought about and sort of tried to optimize their sleep hygiene naturally anyway. But, obviously, environment, the bedroom needs to be quiet and warmish. The bed needs to be comfortable. Noise. Well, if there's noise in the house or else outside, etc., there's always earplugs. Dark. Like I've talked about, the sort of day-night cycle, it's important to have a dark environment to be sleeping in. So lined curtains, or wear eye visors, why not? To maximise the secretion of your own natural melatonin from your pineal gland. There's a lot mentioned about sort of no mobile phone or tablet screen viewing sort of the hour before going to sleep. Why? Because they emit so-called blue light in the blue wavelength band of the light spectrum. And again, I know this because I've looked it up, it's 400 nanometers, that part of the electromagnetic spectrum. That inhibits melatonin release, our own natural melatonin release. And a study's shown that blue light is more stimulating. It sort of brings about the arousal response rather than red light, which in the 70 nanometer bandwidth is sedating. So, no tablets and phones an hour before going to bed. Very important. Structured bedtime. I think this is really important, as sort of the bedtime routine. You really should be going to bed at the same time every night. Be strict, be disciplined, preferably after a relaxing bath or a mug of hot chocolate. Settle down to a nice tame read, a Jane Austen, not a Stephen King novel. You need, as well as a sort of structured bedtime, you need a structured get-up time in the morning. This is also important, to have a routine, to avoid sleeping in, oversleeping in the daytime. It basically means that you won't be sleepy when you get to nighttime if you've overslept in the morning and had a lazy lie-in. And this also applies to the daytime naps. Okay, I talked about daytime naps, and if you've given into a really long daytime nap because you just can't function, you've given into a daytime nap. I'm not averse to or against a daytime nap. I myself enjoy a 15-minute daytime nap after lunch. But make sure it's not longer than 20 minutes. And the reason for this is that at 30 minutes, you descend into the level 3 sleep. You remember at the start, I talked about the different stages and phases of sleep. Okay. And I talked about the deep sleep, the slow wave sleep. If you wake from this, and studies demonstrate this very clearly, if you wake from deep sleep, you feel rubbish, groggy, spaced out, and often disorientated. This is known as, it's got its own label, it's called sleep inertia. Okay. Studies also show that a 20-minute power nap, so-called, increases alertness and thought process, cognitive performance, and learning abilities and motor skills. That's a 20-minute power nap. Okay. And like I said, I enjoy a 15-minute sleep after lunch. After which I, set an alarm for it. But I wake up feeling utterly refreshed and a lot of zing and zest. And, I can just get back to work and feel really charged up. Highly recommended it. I use a mindfulness technique to get me off to sleep really quickly. With practice, you can do this. Even if I can't get off to sleep because, thoughts keep popping into my mind, the time out, the brain rest, makes me feel refreshed and great. Almost as good as actually getting that 15-minute power nap. So I highly recommend it. So all this advice is very general. Everyone has different requirements. Some long COVID patients sleep for 12 to 14 hours and can't help it. They have to give in to it. But regardless of this, I think it's really important to introduce a sort of structured timing of when you get up, get an alarm clock, and hopefully, a structured timing when you turn the light off at night. Okay. And remember those sleep enhancing Jane Austen novels. So, what about treatments for sleep disturbance? Treatments. So, supplements, sedatives, sleeping tablets. What's on offer? And how long to use them for? And what are their benefits and what are their risks? Right. So, first of all, I'll talk about supplements. There's magnesium. So, 500 milligrams at night. So, studies have shown that it reduces sleep latency, i.e. time it takes to get off to sleep, reduces in sleep interruptions, and it increases the duration of sleep. So there are studies worth trying from the health food shop. 500 milligrams, that's what the study used. Don't exceed that. Why not try it? Also in the health food shop, you'll come across herbal remedies, of course. Okay, there's Rescue Remedy, which is a combination of flower essences. There's Nitol Herbal, which contains herbs which are said to have sleep-enhancing properties. Hops and valerian and passion flower. But note, Nitol Herbal, not Nitol Original or Nitol One a Night. That's 25 or 50 milligrams. These don't contain the herbs, they contain an antihistamine called diphenhydramine, beg your pardon. Another antihistamine that can be tried would be the ancient first generation sedating H1 antihistamine, Piriton, chlorphenamine, 4 milligrams, which you can buy off the shelf, over the counter, in the chemist. Not to be used, not recommended in pregnancy or breastfeeding. Certainly worth trying, 4 milligrams at bedtime. Why not? The next is melatonin. Okay, well, melatonin keeps coming up, doesn't it? As I explained earlier, melatonin is our natural hormone, sleeping, if you like, our sleeping tablet, sleeping supplement, natural hormone secreted each night by our pineal gland in our brain. And melatonin has, as a hormone, has sedating effects, as well as the other functions, such as it's an antioxidant, so it dampens sun inflammation. But it aids restful, restorative sleep. There's a synthetic form of melatonin that can be taken to add to our own natural melatonin. It's used to get you to sleep quicker with less interruptions and for longer. It takes 1 to 2 hours to work, so take it a few hours before going to bed. In the UK, it is a prescription-only medicine for the over 55s, or for patients with learning difficulties, or for a short period of time, jet lags. Some countries, it is over the counter. You can get it. A lot of European countries, you can get it over the counter. It's also available online. But, as always, beware of online medicines. If you just want to have a quick sort of refresh on that, go to the NHS website, nhs.uk website, and look for dangers of buying medicines online. Gives you a lot of common sense advice on what to look out for and what to be wary of. There's one reliable source, as recommended by some paediatricians who treat kids with ADHD, and that is biovea.com, biovea.com. I'll put that in the description and in the show notes below. And for long COVID purposes, choose the slow release form, the 2 milligrams, which is labelled as circadian, which is very popular. Look up circadian.com. What are the side effects of this synthetic melatonin? Well, there are some side effects. The most common ones listed are headache and nausea and vivid dreams. It shouldn't be taken along with other herbal remedies. And if you're taking other prescribed medicines, especially those acting on the brain, check with your GP first. It shouldn't be taken with coffee, alcohol or smoking because its effect won't be so good. It shouldn't be taken during pregnancy, as we don't know enough about its safety. It's only okay to be, however, it is okay to be taken with breastfeeding. Beware with driving if it makes you feel drowsy. Obvious common sense advice. You may be asking, why is it prescription for 55 patients 55 and over? Sounds a bit sort of random, doesn't it? Basically, it's because there was a research study done on melatonin, synthetic melatonin, on a group of patients who were 55 plus, and it showed benefits that I've listed above. Why did they choose 55 as the age? They chose it because our natural melatonin starts falling at that age, and so they obviously then based this policy decision on how to license melatonin on that study. Incidentally, there's another study that demonstrates both efficacy and safety of melatonin, done on patients between 20 and 80, given melatonin, and they were reviewed at 6 months and 12 months after starting the study, and they indeed found that it was effective and safe. So, like I've said, if you want to know more, go to the website circadian.com, as I mentioned above, where there's some excellent resources on melatonin, synthetic melatonin and circadian. So those are sort of, first of all, those are some prescription medications for sleep disturbance. Other prescriptions, it's obviously issued by a doctor. Benzodiazepine group of drugs. So the common one was diazepam, but this can lead to dependence, and its effect wears off after you've used it for a period of time, and so then to get the same effect you have to give higher doses, and then you become addicted to it. We want to avoid that at all costs. Other sleeping tablets that are prescribed are non-benzodiazepines, the so-called Z drugs, Zopiclone, Zolpidem. These are less dependency, lead to less dependency, and they can be used in the short term for mild to moderate insomnia. That's what they're licensed for. So the question is, if you are prescribed sleeping tablets, how long for? Short duration is the answer, only a few selected nights per week. What are the benefits? Well, for peace of mind, really, that, peace of mind that you've got something there if you should need it and you become desperate. So, for example, a night for an exam or the driving test, or if you've had a bad run of nights, to reset a disturbed reverse sleep pattern. What are the risks? Well, as I've said before, you can get addicted to them and then dependent on them. They can clash with other medicines. They can lead to non-restorative sleep, and they can have side effects on hangover and dry mouth and vivid dreams. There's dangers with driving and operating machinery. Another approach is to use an antidepressant. Obviously, if a patient has depression and reactive due to circumstances or endogenous depression, as diagnosed by the GP, but also in absence of diagnosis of depression, an ancient antidepressant is used, a tricyclic antidepressant called amitriptyline is used for its sleep-enhancing properties, not its antidepressant properties. It's not addictive. It's also commonly used outside of this, for migraine prevention and for chronic pain syndromes. So, as I say, it's tried and tested. It's been around for years. It is prescribed for other things, but it has sleep-enhancing properties, and so I think it's very reasonable, and I used to prescribe it in place of Z drugs in general practice. So that concludes, if you like, again, quite a long section on the treatments for long COVID sleep disturbance, both the over-the-counter herbal, the supplements, but also the prescription-only medicines. I think it's also important to touch on other things to consider to help with long COVID sleep disturbance. I think we shouldn't forget the sort of more holistic, whole person approaches and strategies that I've talked about before in other podcasts, just as important as the overall management of long COVID. So we've got to think about, and incorporate all these other strategies. So dietary strategies and how to tackle anxiety, and so diet, for example, we've got to think about that mixed, balanced, that Mediterranean diet that provides all those minerals and vitamins and those polyphenols, the spectrum of vegetables and fruit that also contain prebiotic fibre for our microbiota. There's the healthy, friendly bacteria. Oily fish, omega-3 for immune support, vitamin D. All this is so important to consider as part of the whole long COVID package, if you like. So important. I've touched on the effects on the person and their sort of, if you like, their mental, their mood and mental well-being, etc., and being stuck in the flight and fright, the sympathetic adrenaline dynamo brain effects that long COVID can have on any of us, and the benefits of thinking about sort of other strategies such as the sort of the mind-body techniques, so mindfulness and yoga and Tai Chi, just to help incorporate and focus breath control and coordination and sort of ways to allay stress and reduce anxiety, etc. All these things, again, like I said, all part and parcel of the whole package for helping with long COVID. So there we are. That's it. That concludes my talk on sleep disturbance with long COVID. I hope you found it helpful. As I mentioned at the start, any treatments that I mention in this series and in this and in this talk on sleep disturbance and long COVID should only be considered after discussion with your own GP health provider. So, in the meantime, my very best wishes for your long COVID recovery. Cheerio.